Hey there, YouTube fans. How you going? My good old mate, Mr. Soppi from Finland, has done this article as well. It's titled Iron Deficiency Without Anemia, Common, Important, Neglected. I'm going to go through some of the things I highlighted here. Iron deficiency ensures as the end result of a long period of negative iron balance, when iron losses exceed iron intake, or their increased demands. Some of the symptoms are fatigue, brain fog, muscle and joint pain, weight gain, headache, dyspnea, palpitations of the heart, sleep disturbances, arrhythmias, lump in the throat or difficulty swallowing, and restless legs. Some people have been diagnosed with chronic fatigue syndrome. The whole body contains about 3 or 4 grams of iron, but even of a daily intake of about 10 to 14 milligrams of iron in your diet, only about 0.5 to 2 milligrams is actually absorbed in healthy individuals. Diet does not always provide a sufficient amount of iron. On the next page, there are people who are iron deficient. These cannot be differentiated from each other by the hemoglobin value alone. So you might have normal hemoglobin. It's called normocytic anemia. Dramatic exacerbation of the symptoms of iron deficiency in connection with the acute condition or stress. So if you're stressed, you can have a dramatic exacerbation. That's how you pronounce that correctly. Ferritin. The ferritin concentration rises also in inflammatory and infectious conditions. In this sense, ferritin acts like the erythrocyte sedimentation rate, ESR, or the concentration of C-reactive protein, CRP, but the ferritin value does not necessarily parallel the changes of these inflammation markers. The ferritin increases also as a result of alcohol consumption, obesity, and fatty denigration of the liver, fatty liver, in other words. Apparently, an individual's serum ferritin concentration is at least partly genetically determined. There was a patient who had profuse bleeding from hemorrhoids during a few years, and this resulted in anemia or iron deficiency. Prolonged blood loss can result in iron deficiency or anemia. They were treated with and prescribed 100 to 200 milligrams of iron daily by mouth, which he took only for less than 4 months. That's not a long enough time, by the way. Skipping on. However, the patient may be iron deficient even at a higher serum ferritin concentrations higher than 30, I think it's micrograms per litre. It's the little symbol mg. I need to look that up, sorry. The patient was slightly overweight and had type 2 diabetes. Skipping along. After 2 months on iron treatment, her condition began to improve. 2 months that was, and after about 8 months, she was symptom-free. She was on oral iron treatment for 11 months. Some people need to take iron for long periods of time. patients with true iron deficiency anemia, as judged by a negative bone marrow iron staining finding, may have a serum ferritin concentration close to 50. Mine was actually 42. They defined iron deficiency as a ferritin level in heart patients that is below 100. At 100 to 299 with transferrin saturation under 20%. That's how they defined iron deficiency. Ferritin under 100 or at 100 to 299 with transferrin saturation under 20%. Under ordinary clinical circumstances, ferritin should not be measured when the patient has some kind of acute febrile infection or other active inflammatory condition which is reflected in a high ESR or CRP value. My CRP was elevated because the values of ferritin and other markers of iron might be misleading. High CRP affects the tests, but a soluble transferrin receptor and transferrin saturation test can help the doctors to diagnose iron deficiency or anemia. Do not take oral iron or any kind of iron before a blood test. You need to wait at least 2 days. That includes in your vitamins. You might have a little bit in your vitamins and minerals. Do not take it before at least 2 days before any test. It can affect the result. One other of the symptoms related to iron deficiency was weight gain. Nail clubbing was the other one, when you get hooped nails, like, hilled nails, that kind of, or the reverse, spoon nails. It's rare in some people. You'd have to be iron deficient for up to 10 years in some cases. Pica is also rare, where you crave dirt and things like that. It can be very debilitating, disabling during many years, and be unable to work because of extreme fatigue, and they spend most of the day in bed. Sounds like chronic fatigue, doesn't it? They're unable to have a work, and are unable to work out or have a normal life because they have no energy. Their quality of life is close to zero. That's how bad it can be in some people. Iron deficiency without anemia. Some patients with iron deficiency without anemia may have had profound symptoms for many years, while their blood count has been normal throughout. You're showing the symptoms, but your blood count is normal, because the reference ranges on my research is they're really not high enough in some people. The lab reference ranges I'm talking about. A diagnosis of iron deficiency may be very difficult to reach under these circumstances. The diagnosis of iron deficiency in these patients relies primarily on a careful and detailed patient history with special emphasis on symptoms. You may have normal bloods, but all the symptoms doesn't exclude iron deficiency. I'm going to go quickly through this list of symptoms. I had almost every single one of these, and I won't explain them, I'll just go through them because there's so many. Exceptional fatigue, reduced mental awareness, absent-mindedness and poor concentration, headache, hair loss, muscle and joint pain, edema, which is fluid build-up, especially in my legs, shortness of breath and dyspnea. I don't know what that is yet. I have to look it up. High resting heart rate and rapid acceleration of the heart rate during exertion, and you have heart palpitations, weight gain, loss of initiative, you don't care about anything, memory lapses, difficulties finding words, sound familiar in me, vertigo, depression, anxiety, pharyngeal irritation and phlegm, cough, problems with the throat, heartburn, cold hands and feet, diaphoresis, which is heavy sweating or no sweating at all. I had night sweats. Restless legs. You can't keep your legs still in bed. Reduced anaerobic performance. Myalgia, associated with even slight muscle strain. That's pain in the muscles. Sleep disturbances, abnormal menstruation if you're a woman, mild pyrexia, under 38 degrees, not sure what that is. Dry skin and pruritus, dry skin. Easy to bruise. Tongue discomfort, abdominal symptoms, loss of appetite, nausea, weight loss in some people. These are less common now. Fluctuations in blood glucose values for diabetics, especially if treated with insulin. Irritability and anger tantrums, feeling sick, tinnitus and buzzing in the ears, muscle cramps, hot skin, poor heat tolerance. I got my air conditioner on all the time. Memory loss, pale skin, low and variable blood pressure, mine's all over the place, including high mostly. Rapid within a few months impairment of academic skills. You can't learn in school or be a student. Falling asleep involuntarily. Pica, which means you want to eat dirt and things like that. Ice. Nail clubbing, we explained that earlier. Plummer-Vinson syndrome, not sure what that is. Okay, transferrin saturation is important. You could also look at serum hepcidin levels, that's important. Symptoms of hyperthyroidism and iron deficiency are very similar, very similar. Some people have both, hyperthyroid and iron deficient. They interact with one another. Treatment seems to be a relationship in treatment with these two things, hyperthyroidism and iron deficiency, and they must be treated when it's diagnosed, iron deficiency. One of the other causes of iron deficiency, mainly blood loss seems to be a big culprit, but testosterone replacement therapy. Yes, it's written here. Testosterone replacement therapy can lead to anemia, and I'll tell you why. When you're on testosterone replacement therapy, it makes your body makes really good hemoglobin. Okay, you sometimes even have to go and donate blood because it does so much. Here's the problem: if you don't have enough iron or can't absorb enough iron, those hemoglobin levels, even though they're in the normal range, they are sickly. They are like pink. They are hypochromic. They're not efficient enough at delivering oxygen around the body. That's what I've researched. That's definitely there, testosterone replacement. That's what I said to my doctor. Polyps in the intestines, hemorrhoids, as we've said, gastritis, which is stomach inflammation. People that have been erroneously diagnosed, wrong diagnosis, includes chronic fatigue syndrome. That's why I was diagnosed with that, because they share a lot of the same symptoms. Some people with irritable bowel are diagnosed with this, but they really have iron deficiency. ADHD, that was another one. Okay, iron by the mouth. You can get a rise in hemoglobin of 10 to 20 grams per litre. This is not uncommon. Iron deficiency must always be corrected initially. You need to try oral iron. Check with your doctor first. A common recommendation is 100 to 200 milligrams of oral iron daily, but also much less has been recommended. There was a study where teenage girls took 100 milligrams, I think it was, of oral iron once a week, and eventually they were able to replenish their iron stores. I would think that would take longer, of course, but that was in a study. He does say here, Soppi says, occasionally it may be more tolerable for the patient to take one iron pill every other morning, 3 mornings per week, than to take iron pills every day. Research does back that up because your hepcidin levels go down in normal people and then you can absorb more iron. I've done a video on that. 5% of patients do not tolerate a high dose of iron. It can have gastrointestinal effects is one of the main ones. Stop your oral iron, as I said. I think I said this, but stop your oral iron at least 2 days before you go and get a blood test. Before blood sampling for serum iron and transferrin, a 10-hour fast, including no iron supplements, is necessary. This is like ideally 2 days would be the way to go. At higher doses, this is interesting. At higher doses of iron intake, these diet restrictions of no milk, calcium or magnesium products, or proton pump inhibitors, or limiting coffee and tea and cereal products, these diet restrictions have less importance. That's cool. The impact of vitamin C as an uptake enhancer diminishes also when the iron dose increases. In other words, at higher doses of iron, you don't need vitamin C really to absorb it. The impact of vitamin C as an uptake enhancer diminishes also when the iron dose increases. Okay, next, moving on, skipping through his article. Now, I'll read this whole paragraph. The longer the iron deficiency has lasted, the more complex treatment becomes. This situation arises usually among patients who have never had anemia, but they're iron deficient. If iron deficiency has persisted for at least 10 to 15 years, iron therapy treatment, follow-up, and clinical response are often fraught with challenges, and the patient may need treatment and follow-up for up to 2 years. 2 years. In my opinion, iron deficiency with a duration of more than 15 to 25 years may need years of treatment and follow-up, and complete recovery in terms of symptom recession is still not certain. You're still not guaranteed if you have it for so long that you'll not have symptoms. That's a bit sad. Some people have a serum ferritin increase of more than 8 to 10. I think it's micrograms per liter is that symbol. Anyway, mgl. But this may not be accompanied by clinical improvement. Paradoxically, the patient may experience symptom exacerbation after treatment start. That makes sense. All right, so intravenous iron, so getting iron by iron infusion. Ideally, use tablets first if you can get away with it, but it is slightly faster than iron by mouth. After completion of iron therapy, follow-up continues for at least 2 years. You need to be monitored. And I'm pretty sure that they need to retest your blood in a month's time after an iron infusion. Okay, I'm still tired, eh? All right, under optimal conditions, a treatment response may be expected after infusion in 3 to 30 days after the infusion, but only about a quarter of patients respond completely after the first infusion of 500 milligrams, and about 5% of the patients need 5 infusions or more. The infusion should preferably not be repeated until at least 30 to 60 days after previous infusion. So everybody is different. Everybody's level will be different. You need to check with your doctor. The longer your iron deficiency, the more problems you're going to have. There is a rare worsening, he calls it iron utilization disturbance. It's a constellation where after initial increase in hemoglobin of 10 to 20 grams per litre and an above expected increase in ferritin concentration, the patient's condition deteriorates significantly after the infusion and the ferritin level remains high. Hopefully that doesn't happen to you or me. In conclusion, I'll read the whole paragraph. Mr. Soppi, Dr. Soppi, iron deficiency is very common and may be ranked among the most common public health concerns today. Diagnosing iron deficiency, especially if there is no iron deficiency anemia, is a challenge for the clinician. Iron deficiency without anemia seems to be an autonomous clinical condition which needs special attention, as has been suggested earlier. Clearly, we have yet